Guilt can be a silent killer in relationships, especially within families navigating the complexities of caregiving. Here's a breakdown of why guilt can be so damaging in these situations. Societal expectations. There's often a societal expectation that family members, especially children, should be the primary caregivers for aging or ailing relatives. This can create pressure and guilt if someone feels they aren't meeting this expectation. Conflicting responsibilities. Many caregivers are juggling their own families, jobs, and other responsibilities. This can lead to feelings of guilt for not dedicating enough time or attention to the care recipient. Emotional strain. Caregiving can be emotionally draining, leading to resentment, frustration, and even anger. These feelings can then trigger guilt, as caregivers may feel they shouldn't be having these negative emotions towards someone they love. Past relationships. Pre-existing family dynamics and past relationships can influence how guilt manifests in caregiving. For example, a child who had a difficult relationship with a parent may feel guilt for not being more forgiving or present during the caregiving period. Financial strain. The financial burden of caregiving can also lead to guilt. Caregivers may feel guilty for spending money on care or feel inadequate if they can't afford the best possible care. Communication breakdown. Guilt can lead to avoidance and a lack of open communication. Caregivers may be afraid to express their needs or limitations for fear of being judged or seen as uncaring. Resentment and burnout. Unresolved guilt can fester into resentment towards the care recipient, other family members, or even oneself. This can lead to caregiver burnout and further strain relationships. Internalized suffering. Guilt can be a heavy emotional burden, leading to anxiety, depression, and other mental health issues for the caregiver. This can negatively impact their ability to provide effective care and maintain healthy relationships. Family conflict. Guilt can create tension and conflict between family members, especially when there are disagreements about caregiving responsibilities or decisions. Acknowledge and validate feelings. It's important for caregivers to acknowledge their feelings of guilt and understand that they are normal and valid. Set realistic expectations. Caregivers need to be realistic about their limitations and avoid trying to be perfect caregivers. Seek support. Support groups, therapy, and respite care can provide valuable emotional support and practical assistance for caregivers. Open communication. Open and honest communication with family members and the care recipient is crucial for managing expectations and preventing misunderstandings. Focus on what you can do. Instead of dwelling on what they can't do, caregivers should focus on the positive impact they are making and the care they are providing. It's important to remember that caregiving is a challenging journey, and it's okay to ask for help and prioritize your own well-being. By addressing guilt and fostering open communication, families can navigate the challenges of caregiving while preserving their relationships. Thank you for being part of this important journey.